I'm going to hit record and we can go live on YouTube. Just give me 1 second.
Just 1 second.
Somehow today my live is not working. So we'll get started with the session and I'll try it on the side if I can. Just 1 second, if I can try one more time. Hello to all the parents for joining us. We are just getting set up and trying to go live on YouTube, but somehow today it's not working. It looks like it's working now.
Yes.
Yes, we are live on YouTube. There was some technical glitch I think we had there. It looks like it's working. All right, a very good morning to all of you here for being here on a beautiful Sunday morning. Thank you to all the parents for joining us. And we are going to jump right into our program here. Just going to share my screen. Okay. So here we are once again. Welcome to Saamarthya signature program, Swayam Parent Empowerment Series in collaboration with SNIC Rehab Foundation. I'm Dr. Shivani Pandit, and I'm here to again quickly introduce Saamarthya. A lot of the parents I'm sure are going to be our parents who've seen us many, many times as we do these webinars with experts. But for those of you who are new, I am Shivani Pandit. I'm a special educator. I've been working with children with autism and intellectual disabilities for the past 28 years. And I started Saamarthya with the explicit mission of providing high quality intervention services to families that live in tier 2 and tier 3 cities. So we do offer programs for children online. Special education, occupational therapy, and counseling psychology services for children, for parents, and for siblings online. But we also very recently started a family resource center in Baner, Pune, which is a family-centered and a multidisciplinary approach where we offer child-focused services such as one-on-one interventions, as well as parent-focused services, which is parent training and parent coaching and counseling. And we do a lot of public awareness focused services as well. So welcome to all of you for being here. If you have more questions about Saamarthya, what we do and what services you can access, whether it's online or at our Baner Center in Pune, our phone number, our emails are here. And I'm excited to invite our collaborative partner, Harshali Kharche, who is the head of SNIC Rehab Foundation from Nagpur. Harshali, please share briefly about SNIC and what you do, and then we will take it from there.
Yes, very good morning, everyone. Great to see you, all of you here, and it's always my pleasure to do some all the sessions in collaboration with Saamarthya Foundation and its team. And welcome all the doctors. I'm really grateful that we have a wonderful guidance here for the parents. The SNIC is basically, we are from Nagpur, SNIC Rehab Foundation. I'm the Harshali Kharche. I'm the founder and the director of the SNIC Rehab and Foundation. And most of important is I'm the mother of two who are on autism. And I know our organization is for parents and by the parents. So we are here to empower the parents, and to do that, we have various programs with us. We are here to sensitize the parents as well as the society on the various things. So we work on various portion of these things like awareness program, parents empowerment program, financial, and so This is like SNIC. We are doing all overall work. So I would like to welcome Ms. Riddhi to introduce our panel discussion. Yes, over to you, Ms. Riddhi. Riddhi.
Yes, hi. Good morning, everyone. I'm so happy that you all made it on a Sunday morning. Let us welcome our panelists. So we have Dr. Sunil Godbole. Dr. Sunil Godbole, can we spotlight him? So Dr. Sunil Godbole has Masters in Pediatric from BJ Medical College, Pune, and his specialization is in Developmental Pediatrics from Klinkum Bremen Mitte Germany College. I'm hoping I'm pronunciating it correctly. He's a joint director of Chiranjeev Child Diet and Developmental Center and heads the Small Step Morris Autism and Child Development Center at Dinanath Mangeshkar Hospital in Pune. With 24 years of experience, he has guided countless parents on child developmental issues like ADHD, autism, and behavior problems. Dr. Godbole has published numerous research articles, presented at national conferences, and authored over 300 articles and 8 parenting books in Marathi. We are so glad to have you, Dr. Godbole. Thank you so much. Yes. Our other panelist that we have is Dr. Abhimanyu Sengupta. Dr. Abhimanyu Sengupta is a consultant pediatrician with over 3 decades of experience, and he is a senior consultant at Ankura Hospital for Women and Children, owned. He's an alumnus of BJ Medical College. He's done his MBBS and he specializes in immunization, infection diseases, growth, and nutrition. Dr. Sengupta is known for his deep commitment to patients, some of whom now bring their own children to him. He has previously consulted at Surya Mother and Child Hospital and has made other notable institutions. He is a lifelong learner and he actively participates in CME programs. He is an advocate for adoption rights, and beyond medicine, he is also a theater enthusiast, musician, fitness buff, and a painter, writer, and mentor. Thank you so much, Dr. Sengupta. Okay, we have Dr. Nisha Deshpande. She's completed her MD in pediatric and in 1997 and served as a lecturer and associate professor in pediatric for 5 years. From 2003 to 2006, she has trained in pediatric neurology in Canada. Since 2006, Dr. Nisha Deshpande has been practicing in pediatric neurologist in Pune with their own practices in Wakad and is affiliated to Jupiter, Manipal and Ankura Hospital. Welcome, Dr. Nisha Deshpande. So these are our panelists for the day. Dr. Shivani and I are going to moderate the panel discussion. So without wasting any time, let us get started with our panel discussion. I hope we are all in our view as doctors.
Yeah, I think.
Okay.
Yeah.
So let's
Okay,
begin. Yeah. Dr. Shivani, we can start off with our first question for the panelists.
Yes, go ahead, Riddhi.
Okay, thank you so much. So our first question is a question which is coming from the nutritional area. The question for all the 3 doctors is, what type of diet should I prefer for my daughter who has seizure issue, and which food should be avoided? Should I consult with a nutritionist for the same?
Can I answer this?
Welcome, madam.
Okay. So, good morning, everyone. Now, for seizures as such, there's no special diet. If your child has a simple epileptic disorder without any comorbidities, just epilepsy, you can give her any normal home food which is appropriate for the age. I did not get the age of the child, but there are no specific food restrictions for epilepsy as such. But in general, I would say avoid refined sugar because that gives them some behavioral side effects. Rest, everything is fine.
I may just add three rhyming or S words. One is sugar, salt, and spices. For in general, all children will make their diet better. And please avoid going for especially the Google friendly special diets. You will land up in trouble. Already the child is going through seizures, and you add another challenge to the child, and the life becomes bit horrible. So let the child enjoy a quality diet. That's what I will add.
Yeah, thank you, Dr. Sunil.
If I could just
These
add,
are-
I think probably that someone is asking about the ketogenic diet, but I don't think this is the panel, this is the forum for discussing that, right?
Yes,
I
yes,
think probably that merits a special discussion altogether. All right, I think we
yes.
can move on.
Thank you so much, doctors. These are great insights. Moving on to, so what we are doing is we are going to select areas and address each question from the areas. So the major areas that we are considering is nutrition, sleep, and screen time. So we are moving on to the sleep, and the question is, how can I address my child's open mouth breathing during sleep, manage her allergies to dust and fragrances, and improve her overall sleep quality, considering she struggles with sneezing throughout the day and has difficulty during the day due to poor sleep? Is there any testing related to this that we should consider?
All right. Should I take the question?
Yes,
Yes, sir.
Right. Now, your child, obviously, how old did you say the child is, or they haven't specified the age?
No, they haven't mentioned the age.
Okay. So your child has a specific problem and it needs to be addressed in a very specific manner. All right. Now, one part is the nasal allergy. I think what we need to know in terms of awareness and sensitization to this is that a question I very often get asked by parents, children with allergic rhinitis and asthma. I'm putting allergic rhinitis and asthma in the same basket because they very, very often coexist. And one who has a patient who has one today will probably turn up with the another day. So they are very closely linked with each other. Now, a question I very often get asked is there something wrong with my child's immunity? Do I need to give him some? This I'm saying specifically. There's a question in: do you have foods to build the the immune system? There was a question in the question list that was posted, but my simple answer to them is there is no immune deficiency involved. This is something called as an immune dysregulation. To simplify matters, it's like see, we are all exposed to these proteins, these antigens which are present around the air. They are all going into our system. We are all reacting in some way to them or the other because that's a function of our immune system. The ones who have allergy, they have a kind of hyper reactive state. That means they react much more than what others are doing. So the treatment strategies essentially uh, are directed towards toning down this response. All right. Yes, you have very specific treatments. You have, if it's a persistent problem, then yes, you could go in for allergy tests. Allergy tests are pretty simple now. You have skin prick tests and you have blood tests for allergy. You can probably identify the allergen. If it is an identifiable allergen, you can even go in for something called as desensitization. There's something called as sublingual immunotherapy, where the antigen which is triggering the allergy is given in very, very small doses under the tongue. Having said that, getting an allergy test positive to a particular allergen does not always correlate with clinical allergy. That means the patient might not in real life be allergic to that, even though the test shows an allergy. Okay. And then coming to the open mouth and the snory breaths. Well, yes, allergy is a cause. You should be also looking at the adenoids. Adenoids are glands which are located similar to the tonsils, but they are located behind the nose, above the roof of the mouth. They are not visible in, when you shine a torch into the mouth. So they are seen either with, there's a special X-ray which is done for the adenoids, or you can get something called as an rhinoscopy. Okay, a little tube is passed into the nose and you look at the back of the nose. So with that, you can get an idea of the adenoid size. The adenoids, because of their peculiar location, when the child is lying down, they tend to press on the inlet to the airway and they cause a horrendous snoring sound. So yes, they too need to be addressed. So each one is addressed in a different way. I think I've covered in broad general terms. Would Dr. Sunil or Dr. Nisha like to add to any of this?
I think sir has given a wonderful clean answer, so it has covered everything. Just I will add, there was a question similar added to this about the exercises. And let's go back to our own tradition of pranayama and yogasana. Especially above 5 years of above age, we can teach our children deep breathing exercises. And those deep breathing exercises are a wonderful way to take care of most of these upper airway problems in a non-medical ways. And that habit is very important. I'll just add one more philosophical sentence. By God's grace, we are given a number of fixed breaths and not number of years. So increase your breaths, you will live longer. Yeah.
I would also just like to add one thing, because they said that there were also sleep issues associated. So for the sleep issues, the breathing part of it has been covered. See to it that you have a clean sleep hygiene. That also helps in a good night's calm and deep sleep.
Absolutely.
All right. Just to add, there's a question on in the chat box. Is eczema related to the conditions? Yes, eczema is part of the same condition. Infantile eczema, asthma, and allergic rhinitis, they usually coexist, and it's called atopy. Basically, the condition is called as atopy. It's a tendency to hyperreact to environmental stimuli. So sometimes it manifests in the skin, sometimes in the mucous membrane of the nose, sometimes in the mucous membrane of the respiratory tract, the lower respiratory tract. So accordingly, it's called eczema or allergic rhinitis or asthma.
I love the way all the three of you have answered this in so many different perspectives, looking at how to sort it out, what should you look at, and then the holistic approach of ensuring that children learn how to do deep breathing above 5 years of age. I don't think that's talked about often enough in general, and I think that's a good practice for all families, as well as looking at the sleep hygiene. I know this is a question that may not relate just specifically to this parent who asked it, but I think to all the parents who are here, I think sleep hygiene, sleep routine comes up as a very big topic of discussion. So I think that's a great point that you have brought up. So thank you for that. You want to go to the next question, Riddhi?
Yes. So yes, thank you so much, doctors. I think you've given like a holistic perspective. I hope the parents are making a note of this, because this is great information which can be used for you. So moving on to the next question, it's about a screen time concern. The question is there a risk of addiction with excessive screen time for a 6-year-old child?
I'll just add one thing and then everything will be open. There is already addiction by 6 years. It's not a risk. The children by 6 years, 90% of the children, unfortunately, and thanks to we parents who have got right to control that, they are addicted. So I think we'll add the other two honors can add to the things.
Yeah, I would like to just continue here, as Dr. Godbole has rightfully said that by 6 years, if the kids are exposed, they already are addicted. So definitely the answer to that question is yes. Now, secondly, the usual addiction, the usual screen exposure starts when they start weaning the child. So these days, we doctors have started telling the parents not to expose the child to the screen as early as 5-6 months of age, because usually the parents find it easy to feed the baby when the baby is diverted looking at the screen. That is the age at 6 months. As they start with the weaning food, they would start with the screen exposure. Now, somebody has asked about phone rhymes and all. See, audio exposure is always acceptable, but video exposure is the one which has addiction liability. And let me tell you, children also always had food and were thriving well when there were no screens. So screen is not, I think, an alternative to diversion as to making the children do something which they should be doing. So please, there is a big no, N-O capital, to screen exposure. Yes, audio is fine. Songs are good. Or best way is to keep them near a window or in the balcony of your apartment, so that they can see birds and trees and leaves. You can teach them colors. You can show them vehicles if there are no trees around. You can teach them the colors through the cars, etc. But please do not expose them to screen.
I'll just add one more point to Madam what says, saying that why don't we compete with the screen? What the children are learning that my mom doesn't know how to sing. This screen tells me the songs. And that adds to the speech learning capability also. When the child sees his mother, whatever may be the her quality of, it doesn't matter. When mother sings, it's always beautiful to the child. And when he sees her moving her face, enlightening on that, and he's going to copy that. And that's a beautiful way of learning to speak. And here what happens, if I want to get a stimulation, I click the button. So we parents are losing to screen. So let's start competing with the screen. So that's what I'll add to that. Abhimanyu.
Yeah, if I might add, just one point I wish to cover. It's about the norms for screen time. Okay. Now, how much is too much screen time? Now, see, this would depend on the social setting, how much is kind of acceptable in your family or in the social setting where you belong. But most authorities worldwide, they agree on certain norms, which are age-wise norms. Below 2 years, everyone recommends no screen time, no exposure to the screen at all, except for occasional video chats with relatives or friends, which are parentally supervised. Okay, so below 2 years, please no screen time at all. If you can manage that, then probably things will be a little later in the later years. Between 2 and 5 years, maximum 45 minutes to an hour per day, supervised screen time, supervised by a responsible caregiver, preferring educational or interactive content, short duration content. Okay. And beyond the age of 5 years, 5 years to 17 years, maximum 1.5 to 2 hours per day on weekdays, and maximum 2 to 2.5 hours per day on weekends. Okay, that too without compromising their daily activities, their exercise, their sleep, and everything else they are required to do. All right, that is one part of it. The second part is, it is not just the time that they spend on the screen, it is monitoring the content that they watch on the screen. There's something called as healthy screen time and something called as unhealthy screen time. Healthy screen time is something which is used for pro-social activities, and unhealthy screen time is used simply for entertainment or visiting unsafe websites, or different other harmful effects, the harmful sites that are available. All right, that's one part of it. The second thing I'd like to mention is one point which Dr. Sunil brought up is, you can replace, if you want to address the problem of screen addiction, you can replace it only with human interaction. Okay, there is no third option. So you have to explore that to the fullest. Okay, I cannot understate I cannot overemphasize the importance of this human to human interaction in dealing with screen addiction. The second thing is, the screen has to be linked to a concept of time that helps to set limits. For example, you keep an analog clock next to wherever the screen is, and say that when the minute hand reaches this, you're going to stop the screen. That teaches them two things. One, it teaches them to know the concept of time, and to know the discipline that when the clock comes here, when the needle comes here, I'm going to stop watching the screen. The third thing is, it helps to a great extent if you can switch from a small screen, that means from a smartphone, to a big screen such as a television. Okay, the addiction potential of a smartphone is much, much more than that of a TV, mainly because it is much more easily accessible. I think we have a lot of tips for parents for managing screen addiction, but I think this would serve as a basic kind of a primer.
Wonderful.
Yeah, I really like
that was nice. I would just like to add here, many a times I tell the parents that maybe even if 3 families, they can form a group. So if the problem these days is, there are most of the times they just have a single child. That is, it's a nuclear family with one kid, both parents working online in front of the screen. Sometimes it's difficult to manage the child without leaving your own screen. So in such cases, I tell them, you can always make a group of parents, so that, say, if there are 3 parents, they take responsibilities 2 days each during the week. So every Sunday, the respective kid is at their own place with their parents. 2 days by rotation, even if they say 2 to 3 hours a day, one parent takes responsibility of 3 kids. So out of 24 hours, these kids sleep for good 8 to 10 hours. the routine activities like bathing and having food, etc., will take another 3-4 hours. So 12-14 hours are gone. Remaining hours, even if 2 to 3 hours, each parent takes responsibility of 3 children 2 days a week. So that completes 6 days a week of these children getting engaged and staying occupied with other children. So that 3 in a group monitored by 1 adult. And then they can also appoint 1 caretaker who can do the same for 2-3 hours separately. So this majority of the time solves the problem. If there are 3 parents and they make a group, like something like a group parenting.
Wow, I am so amazed with all the insights that we have received here. Parents, I do hope you are taking out a notebook and making these points, like write them down somewhere. These are really incredible insights. So what I learned in this particular segment is that I think screen time, you talked about a little bit about the regulations of the number of hours. And I think if it's educational content, the amount of time that you're showing and the short burst that Dr. Sengupta talked about, instead of just allowing the child to sit with the phone for a longer period of time versus deciding how much time, setting that limit. And I think the passive versus dynamic learning also, I heard that the human interaction is very important. If you're using the screen to talk to dadi, nani, uncle, that versus the child just watching a video passively with no human interaction, I think that would be something I would encourage the parents to think about. If you are using that, how are you using the how is also equally important. I think the big screen versus small screen was a big one. I think please do pay attention to that. Oftentimes nowadays we all have smartphones, and so the phone is in front of the child, and then it's harder to set those limits, right? And I think the last point was excellent about sort of, they say, right, that it takes a village to raise a child. So I think what Dr. Deshpande is talking about exactly is that we live in a society now but it's nuclear families, small families, and we are sort of all alone within our own units. So is there a way that you all can think about creating a sort of an extended family with your friends, and seeing how that approach could help you take away the child's attention and focus so much from what's happening today, which is the phone. So thank you so much. I think that was very insightful. Do we have any follow-up questions on this one on the chat? I just want to make sure we can just wrap this up if there are any further follow-up questions. I think you all explained this pretty clearly, but is there anything, or then we can move on to the next question?
Yeah, I think we have almost covered everything, but the parent who has asked the question about the rhymes, the parent is also saying that she has a 10-year-old child and the child doesn't go to school as there are no facilities. So I think it's because from what I understand, it's the time that the child needs to invest. And I think because there's so much of time left in the day, that is why the parents are giving the phone, is what I'm
Yes.
understanding.
And
Yeah.
I appreciate her challenge. I appreciate the challenge. The child who is at home and a whole day in front of her. For the mother also, even though we say as a doctors, we can preach. Doctors are preachers. We can say that you should not be seeing the screen. But if you go into the shoes of that mother, I totally respect the plight she is going through. So she needs those inputs apart from screen to keep the child busy. I don't know the child's capabilities, the functionalities, and all that. But she should talk to the developmental pediatrician who working with her and find out such multiple inputs rather than only of having screen as an option. And that can be achieved by having some hand-eye activities at one time. And you have to have a chain of such activities. It can't go by saying that only I got these 4 options. And that is one thing. A wonderful idea one of my parent, a similar parent has done is she has added a home help and a very chirpy girl who is connected with that child and keeping the child engaged. That is one thing which can help. And one more thing, if the child is communicative, I don't know about this child, is communicative. It's a good idea that use the TV as a teacher. When the child sees a half an hour telephone, stop it for a while, discuss what the child has said. It's a learning process. And now the same TV becomes a teacher to the child. That's what I can add when I don't know the background.
Dr. Sunil, if I might add, there was a there was a question in the chat box. I don't know whether it's the same parent messaging saying that the child has cerebral palsy I don't know if it's the
Yes.
same one. I'm not very sure. Is
Yes.
just if you could just clarify.
Yes, sir. It's the same parent.
It's the
Yes.
same child.
Yeah.
Okay, so maybe Sunil, you can give any specific insights for
Yeah,
that.
then it's CP now, but now we need to know it is only CP. There is a strength in his brain, and we can really work with his cognitive capabilities, with his interactive capacities, and the again everything like Madam Montessori says, play, play, play. Play is the occupation of the child. So we start playing with the child, and the best play lab, which is highly invested in every home, is the kitchen. Kitchen is a sensory lab of more than 5 lakh invested in that kitchen. So use that sensory lab for this kid, and things will start becoming very enriching for the child.
Wonderful.
Love the inputs. Yes, I think we are getting all very practical, very applicable approaches and ideas. I just love the input. I think this is not just a learning for the parents here, but for us also as professionals. I am making notes for myself as well. Thank you so much, doctors, for your valuable inputs. Moving on to the next round of questions on
Just
nutrition.
1 second. Can I add something
Yes,
in
yes,
like
please.
my experience?
Yes, go ahead, Shali.
Yeah, because the screen time I've also seen is a big issue. What I have experienced is when we were young, what we used to do when there is no screen. So we used to explore more things. So if we give the chance to kids to explore, they will certainly explore. It's not about neurodivergent divergent skill kids or neurotypical kids. It's always there in their instinct because as doctors Godbole said ki they are natural instinct within. Play. That is their play is their occupation. So I would really like to say the parents that please explore more physical things with them. उसको रख दो साइड में तो सब आ जाता है like that. Yeah, thank you so much.
Take just extra addition. Play with your child. The quarrels between the husband and wife will decrease. Try it out.
Yeah, that's
Yes.
a great suggestion. Okay, moving on. I can see a lot of questions in the chat. Parents, please note that we're not addressing any questions which are medication related. We encourage you to book appointments with the doctors individually at their clinics for further investigation because this will need a proper understanding of the diagnosis. So please, let's refrain ourselves from that, and we will address all the questions that you all have in the end. We have a question and answer round later on, so keep posting your questions. If time prevails, we will definitely address them. We are going to first address the questions that we've already got from the parents through their Google forms. So going on to the nutrition related question, the question is, my daughter has become extremely difficult to feed ever since she has turned 2 and she's started going to preschool. What can I do?
I think that 2 years, why that two times, terrible twos, terrible teens, threes, and all that words, they come from a very interesting concept. Till that time, the child is her mother's child. So everything the child looks for and takes over is how the mother wants. But now there is a sudden spark in their brain. I am somebody different. So if I have to prove that I am somebody different, I have to deny what the mother is saying. And by now, the mother is in a commanding position. उसको लगता है कि I am going to manage this child is my responsibility and उसकी पूरी आगे जो उसकी misword होने वाली वो मेरी responsibility. It's not so. So now what happens? So mother says you have to eat that particular food. Child likes that food. But what the child now wants to answer? I need to prove myself. So I'll deny that. So the first reason is that autonomy the child is asking for. So the answer to that is give a choice. She's your own beautiful girl. She's born from your own family. It's your own child. So if you give them option out of three things, and one of the option is what you want, she'll select the same option. She's your child. So instead of giving a decision, start giving an option. But the trick in it is the option should be all options should be yes. Now, so you give option between dal chawal and pizza. Obviously, we know the answer. So we have to be very careful on that autonomy part. Second part is actually they are sometimes not refusing to feed. They're playing with the food. That is the way they get interaction, especially when both the parents are working, and I do work from home is a very horrible thing. The mother is there, but not yet talking to me. Now the child understand when the child is with the mother during feed, wow, this is an opportunity to grab the mother's attention. So they start that attention seeking business. And for that attention seeking, they know how to manipulate the thing. So that's the third point to come up. They start learning to manipulate. We all try to manipulate the things around. And children are experimenting. And who's the best person to experiment with is the mother or father. So they want to break that boundaries. Look what happens when they break the boundaries and they come back. Fourth thing, which is very common with the thing, is the routine is that the diet pattern is very much fixed, and we are doctors are responsible for that. ऐसा ही खाओ, इतने calories खाओ, इतने proteins खाओ, and Google is adding cream to that. So that is making their life more difficult. I always say that how a child's diet should be. Don't take it wrongly, but it should be like a lady's dress. कल का आज नहीं होना चाहिए, आज का कल होना नहीं चाहिए. And you work like that, then all this food stuff will occur. And the last point to add is, we decide the child's diet from our own diet. मैं इतना खाता हूँ तो मेरे बच्चे ने इतना खाना ही चाहिए. अरे नहीं, उसका एपिटाइट है. आयुर्वेद में बोला जाता है हमारी मुट्ठी जितना अपना खाना होना चाहिए, लेकिन हम अपनी मुट्ठी जैसा अपने बच्चों को खिलाते, बच्चे की मुट्ठी जैसा नहीं खिलाते. एंड दैट इज वेयर द थिंग्स गो रॉन्ग. सो उसका लिमिटेड रहता है. द रूल फॉर दैट इज SMS, स्मॉल मल्टीपल सर्विंग्स. थोड़ा थोड़ा बहुत बार खिलाओ. अपनी बच्चे स्पैरो जैसे थोड़ा थोड़ा खाएंगे, एंड तब जाके आपकी मारामारी कम होगी. डोंट फोर्स द चाइल्ड टू इट. मजा नहीं आएगा. Add to others.
If I could just add to that.
Please, sir. Yeah.
Dr. Sunil,
Yes.
are you done? Yeah. If I could just add to that. Dr. Sunil gave a wonderful insight of where this is coming from, as in trying to look at it from the child's perspective. What I would add to that is, please remember, this is the age for unending curiosity, okay? Because they are discovering new things, they are discovering new abilities, new capabilities, new competencies. So they are naturally very easily distracted and very distractible, okay? And that typically occurs in meal times, because that is the time when you need to be there, and you need them to be there in one place. The second thing is that the rate of growth of children, the rate of physical growth of children is much slower in the toddler years than it is in infancy. So if you try equating the diet that they had during infancy, so much going in every 2 hours, the math is not going to work out. Okay, you need to factor in for that. The third thing you need to know is, by this age, they are pretty good at auto-regulating their nutrient intake. Okay, even if they miss a meal, they generally make up for in the subsequent meal or in the meal after that. The important thing to remember is, do not provide unhealthy options in between. Okay, so whatever it takes, do not give them unhealthy options. But remember, they're pretty good at auto-regulation. Having said that, I'll just go through quickly some tips which I the other thing, yes, coming to the behavioral part of the toddlers, is I very often tell my parents, this is like a sneak preview to adolescence, okay? So you just know what your child is going to be like in the adolescent years. Only at that time, their retorts are sharper, more physical, they have more verbal capabilities. Now they don't, so they follow the mantra, Gandhiji's mantra of non-cooperation, okay? And that's how they get to you. All right, so what you need to know is, please avoid separate meals, except, of course, when you have food allergies or other health conditions. Your child is going to eat whatever is cooked at home. Do not ever bribe your child with food. Do not use food as punishment or reward. Please set a time limit for meal times. Do not serve difficult to eat foods, because if you give a food which has to be peeled and then cut into pieces and then pushed into the fork and then forked into the mouth, the child doesn't have the time and the necessary. It involves a lot of coordination, a lot of time. The child does not have the time for that. So please keep that in mind, especially when you're packing the tiffin box. Please do not rely on the school breakfast, okay? The child has to have a breakfast before leaving home. Breakfast, please remember, is the most important meal of the day, because it breaks the fast between dinner and the next meal, which is the longest gap that the child has between feeds. So please see that the child wakes up early, has a breakfast, and then leaves for school. Whatever he may eat in the short recess or the short break does not matter. What he eats before going is much, much more important, okay? Avoid screen, very importantly, since we dealt with screen time. Please avoid screen and other distractions during meals. Please avoid running after the child during meals. Do not ever fall into the trap of giving unhealthy fast foods when you're shopping at the supermarket, because that's a danger zone. Okay, if you take your child supermarket shopping, immediately they zero in on the foods that they are not supposed to be eating. So keep your stock ready. Keep, say, for example, buy uh, a little bowl of yogurt at the supermarket, something that they can eat. Okay, give them fruit yogurt. That's something healthy among the supermarket foods. All right. What you should be doing is serve appropriate helpings. Lead by example. Unless you eat properly, unless you lead a good healthy lifestyle, you cannot expect your child to follow the same. Offer choices within limits of healthy eating. When planning meals, be creative, be inventive, experiment with colors, experiment with textures, experiment with the serving bowls and the spoons. Whenever you start new foods, start with 1 to 2 small bites, because remember, children are inherently resistant to new foods. So start with just 1 to 2 small bites. Try at least 20 to 30 times before you give up and say that my child is not eating. Get your child involved in the preparation of food. Okay, children can help in various ways. They can wash the vegetables, they can they can wash the utensils. That gives them a sense of ownership, a sense of involvement in what they are eating. When the setting is socially appropriate, please let them play with the food. Like Dr. Sunil said, back off a little with mealtime rules. Please regulate your anxiety and emotions at mealtimes. It's a very common flashpoint at mealtime where the mother gets angry, the father gets angry, the child gets angry, and it's in general. Please remember, the meal time is supposed to be a pleasant time, a time for person to person interaction. Please let it remain that way. Keep it pleasant. It's okay. You can bend the rules a little bit. For instance, you can change the setting of the meal for, say, one odd meal. If the child is acting too difficult, maybe you can sit on the living room floor, or you can take it out to the park and say that we're going to have a picnic meal today. Please ensure that all the caregivers are on the same page with the diet. Okay, this is something which is very, very important, because very often what you think is probably not what the grandmother thinks or what the grandfather thinks or the father thinks. So all of you need all adult caregivers, they need to sit down and say that this is what the child is going to eat. You need to agree on that, because once the child knows that there is difference of opinion in between the caregivers, then they take full advantage of that. I think that would just sum up all the tips that I would have for parents with difficult to eat toddlers. Dr. Nisha, would you like to add something?
Yeah, I would just, most of beautifully covered by both the doctors, but few things just I would like to highlight just to sum it up. First is, in a nutshell, everything has been told. First is, no screen while eating, number one. Number two, toddlers is not an age where you make fixed rules that you have to eat at the dining chair and the dining table. Be flexible as to where the child is eating. Number three, do not run behind them. Make it a point that wherever you sit, whether you sit on the dining table or you sit in the balcony or you go and sit in the park, you sit and eat. We don't run and eat, we sit and eat, is the message. Next is, as Dr. Abhimanyu rightfully said, do not give them unhealthy options, like whether, I'm sorry, Dr. Sunil said, whether dal chawal versus pizza. Do not offer bribes. If you finish dal chawal now, maybe I'll buy a pizza for you in the evening. No, there is no bribe business. And lastly, remember, there is a lot of negativism at this age. Scientifically, as soon as you use the word no, the child has to do that, whether it is with food, with any other activity. So no is out of your vocabulary in any language. Nahi, mat karo, no, not at all. Because there the tussle starts. You say no, the child does it, you get agitated, the child gets agitated, and there is a war. So be positive. You can, as sir said, you can ask the child to participate in cooking. For example, the regular, not the actual knife, but the fork and knife wala food knife. You can give a knife and ask the kid to cut some vegetable and say, today you have made this. Let me taste how you have made this vegetable. So basically, out of tricks, you try to divert the kid and avoid using the no word at any cost. Don't shout. Statement can be said, dheere bolo. Zor se mat bolo or dheere bolo, meaning is the same. Bhago mat. You can say, yahan baith jao. So just see to it that your statements are positive. So the overall personality of the kid also is not negative. That's the last thing.
Wonderful. just routine se out of the thing. What Dr. Abhimanyu was saying, I'm just going to add one more point to that. That mall is a classic case of autism. I always say, you take the thing on your own, you don't talk. You put it in the trolley, you don't talk. You pay by the credit card, you don't talk. You take it in with yourself, you don't talk. So that's the way the mall works, and that's the way we should not be doing it. Yeah, I think we'll go ahead.
Love it. I think only with food, there are so many other things that we've covered. Screen time, texture, the mall analogy itself is so good. I love this. Moving on to the next section of sleep, the second question that we have is, what could be the cause of a child frequently waking up during the night, crying without opening their eyes, and hitting their head and legs, with the behavior lasting up to an hour and occurring intermittently for the past year, seemingly unrelated to hunger, thirst, or pain? Do we need to take him to the doctor? What testing might be required?
This is something called as a night terror. So we got multiple words used with sleep and sleep issues. उसमें से one thing is nightmare and another thing is night terror. Nightmare is a dream sequence. Right? Night terror, as the word says terror, the child gets some unknown fears in his mind, and the child is actually in the, we call it non-REM, non-rapid eye movement area of the sleep. When the child is going through that terror, that fear, that anxiety of something or other, that may not be the dream. Child is unable to explain what is happening to him. He starts shouting, but he's still in the sleep. So his eyes are closed. This can continue from 10 to 45 minutes. This is very, very common. Exact cause, अगर मुझे पता चला तो I'll get a Nobel Paritoshik, but it's not yet known. But there are many things. It is common in the families. It is common in the early ages, but it goes on decreasing. That's the beauty of it. Most of the night terrors, they scream, they push, they cry, all that thing. Even the children have a tendency to sleepwalk. Everything is okay. It looks very ghastly to look at. But is the child suffering? He even doesn't remember. Nightmare, the child may remember. The dreams the child may remember. But night terror, everybody else remembers, but the child doesn't remember. And that too happens at a very wrong time of when everybody is sleepy, especially in the first half of the night. This can happen. Usually it doesn't require any therapy, except where Dr. Nisha will be much better to tell you about is this may be a differential diagnosis of a seizure or an epileptic problem in the child, and where you need to consult if there's a pattern in it, and when the child is she will be a right person to explain. I want her to add to that point. On night terror per se, what I will say is keep calm. What are the management techniques? Work on the sleep hygiene. We are seeing again and again. Anxieties are a cause, so the child should sleep with a comfort. A 10-minute day talk, what happened during the day, and the child sleeps much better with that. Second part is make the sleep hygiene environment calm, quiet, because that may be adding to the problems. Anxiety of separation, that American idea of keeping the child in the next room within from the first few months is a torture to the child that may add to the sleep issues more. And when the child goes through the terror, pehla thing is keep control, keep cool. So start telling your all is well, all is well. This is nothing going to happen. Take the child with you. If the child becomes awake, just let him know that you are there. कॉमन मदरली एरर इज हम उसको थपा थपा के सुलाने की कोशिश करते हैं. वी स्टार्ट सो जा बेटा नहीं तो गब्बर आ जाएगा. गब्बर तो अंदर अपने अंदर है, सो वो उसको प्रॉब्लम होता है. दैट इज द टाइम चाइल्ड शुड एक्चुअली रिलीज हिज एंजाइटीज. So let the child become awake, look at you, then you comfort the child, I am there, and then let the child go into the sleep again the way the child wants to, and that is the best way to work upon it. Do not panic. Do not start giving medicines for that as far as possible. If there are such, what Dr. Nisha, I'm very sure she will add to that point. If there are such diseases, then yes, you need to take a consultation. Most of the time, night terrors disappear by 7 to 10 years of age, and we don't require anything about it. Dr. Nisha.
Yeah. So Dr. Godbole has talked nicely about the night terrors and nightmares. Now here, if you feel that the episodes happening have a typical trend, they are similar types, maybe sometimes associated with some vocalizations, like some either throat clearing sounds like or sometimes just something like a singing, oh, it either starts or somewhere in between there are similar vocalizations, or sometimes there are some jerks either of the limbs, maybe hands or legs, or some neck turning. If there are some similar type happening during every episode, that could be, I'm saying could be, not necessarily will be, that could be type of a seizure or a fit or a convulsion, which needs further investigation. So if these episodes are happening repeatedly, I would suggest that you try to video record the episode. These days, every cell phone has a beautiful video recording facility. You can just, without panicking, take a deep breath, record a nice video with a close-up of the child's face, where sometimes the facial expression also gives us a clue whether it is a fit or it is a non-epileptic episode. So try to video record the episode, and if it has a typical pattern which does not fit into either a nightmare or a night terror, which a clinician would be able to identify better, you can take the video, visit a pediatric neurologist, describe the episode, show the video, and if required, then they would ask you for an investigation called electroencephalogram, that is EEG. The way we do an ECG for the heart, somebody complains of a chest discomfort or a pain around the chest, and the doctors asks you for an ECG, and the waves of the heart will tell you whether there is a heart attack or something. Similarly, there is an EEG. It's a harmless procedure. We put electrodes on the scalp, record a graph, and depending on the waveforms, we judge whether the episode that is happening is a fit or it is an epileptic episode or a non-epileptic episode. Sometimes clinically it is very difficult to differentiate whether it is a night terror or epilepsy, because these vocalizations, jerks, neck turnings might not be always there, and it could still be a seizure. So EEG is a safe test which can rule out whether it is an epileptic episode or a non-epileptic episode. That's it. Thank you.
There is a question in the chat box which is just added to that about that child fidgeting and moving the limbs. Night terrors are associated with restless leg syndrome. So that will actually another, we not have to work upon it. Night terrors are associated what Dr. Sengupta was saying about those typical apnea, what we call obstructive sleep apnea syndrome. So we need to rule out those things along with that. And again, we need to work on those causes rather than on the night terrors.
Can I just add one more question I'm seeing
Yeah.
in the chat related to sleep is there, what's the definition of adequate sleep for a certain age group? So they're talking about 6 to 10 years of age. Do you define this for children at different ages? How would you respond to that?
Well, could I take a question, please?
Yeah.
Yeah. So I'll give you the norms which are prescribed. Now, this is again something like a screen time, but it would depend on what is appropriate for your family. But more or less, the agreement is between 0 and 3 months. The newborns, they typically sleep between 14 to 17 hours. Yeah, sometimes that seems a little too much, but well, they do in those little bits and pieces that they get. Between 4 and 12 months, it's usually around 12 to 16 hours. Between 1 and 2 years, it's about 11 to 14 hours. Taking into account their afternoon sleep and their little mid-morning nap if they have one. In preschoolers, it should be about 10 to 11 hours. In between 6 to 12 years, it should be about 9 to 12 hours. And 13 to 18 years, it should be 8 hours minimum to 10 hours maximum. Okay. So this is from the American Academy of Sleep Medicine and National Sleep Foundation. These are the norms that they have prescribed. Okay. I haven't found any Indian data to corroborate this. And while we are on the topic of sleep, I don't know, do we have a question on sleep hygiene? I just like to dwell on that for a minute, if I may.
I don't see a question, but I do think that's a great.
It's a good idea.
That's very, very important. I think that is the more important issue here, rather than discussing specific obstructive sleep apnea and night terrors and things like that, because those are very, very specific problems which require to be addressed specifically. So helping your child to sleep better is very, very important. Now, in today's typical nuclear family, what happens is that the father usually comes home from work at post 9 o'clock at night, and then starts playing with the kids. The TV is on full blast. everyone, there's so much stimulation, and then the father settles down, then they sit for dinner. By the time they're done with dinner, then the child is so keyed up because he's probably connecting with all the family members that it's very difficult for them to unwind and just turn off the button and go out to sleep. So you need to create an atmosphere that is conducive to sleep, which is very, very important, which brings me to this topic of sleep hygiene. So establishing a good sleep hygiene means developing habits that will help your children to get good sleep at night. Now, please remember, you have to obey the body clock. This is something I think probably Dr. Sunil sees more adolescents than I do, but this is something which is becoming more and more frequent. Just ignoring the body clock, staying awake all night. There's something called as the circadian rhythm within the body. This is related to all the organs and the systems that work. They are geared to have a period of rest at night and work during the day. That's the way we are built. That's the way we are hardwired, and you cannot change that. If you try changing that, it changes the entire biological clock. So obeying the body clock is very, very important. Sleeping at the same time every night helps your child's body to remember to feel sleepy. Okay, during holidays, the difference in sleep time should not be more than 1 hour. Very, very important. Okay, now improving the sleep environment, the child's bed must be comfortable. The child must feel safe. It must be away from the television, from computers, from digital devices. Set up a bedtime routine. Bedtime routine, I cannot overstate the importance of a bedtime routine, because most kids or most parents that come to me, who come to me with the child is not sleeping well at night, is because they don't have a good bedtime routine. It all goes haywire. The child is watching TV till 11 at night, and then the parent just expects that they'll just turn it off and go off to sleep. It doesn't happen that way. So you need to avoid the TV, computer, video games 1 hour before sleep time. Read to the child, tell a bedtime story to the child in the period before bedtime. The 1 hour preceding bedtime has to be a period of shanti, a period of peace, a period where the child goes into the bedroom, the lights are dimmed, the child is only with a caregiver. You can have a little soft music playing. If you cannot control the ambient noise, you can try using a pair of earplugs. You can get your child to take a warm bath before bedtime. That sometimes helps in inducing good sleep. Avoid giving chocolate, caffeinated, or sugary drinks at bedtime. Okay, these are the little tips I would have to help children sleep better. Yes, any inputs, Dr. Sunil or Dr. Nisha?
You have said very rightly that early to bed and early to rise is really, really important. The three wonderful neurochemicals, the dopamine, the serotonin, and steroids per se, they're in a high amount, in a good amount in the morning. Dopamine gives you that happiness, serotonin gives you that alertness, and steroid gives you that energy. So this is the time we should work and learn. And when the melatonin, which goes with sleep, this is the time we should sleep, we should relax, we should energize. Apna but mobile requires a charger, that we accept, but we don't accept that we require a charge. So that charging time is a sleep time. Let's use that wonderfully.
Okay, if I can just add, just to clear a misconception, parents should not go with the idea of giving steroids to induce good sleep.
No, yeah,
Okay,
it just they come in the body. Absolutely right.
What Dr. Sunil is referring to are endogenous steroids. That means steroids which are produced in the
Absolutely.
body by the adrenal glands. Okay,
Yeah,
they
I
are
totally
they
agree.
regulate the body systems. Okay, this is nothing to do with the steroids which are
The,
given by in terms of
Exactly.
medication.
absolutely not. We are not thinking of that. Our own steroids, we should be using them rather than buying it from or borrowing it from outside. Abhimanyu, I respect your perfect intervention. Thank you. Hmm.
You're welcome.
Thank you so much for your insights, doctors. I'm just learning so much. The circadian cycle is so important for us, which all of us forget. And in fact, when I have been conducted workshop, I was always questioned, what about the weekends? So thank you, Dr. Sengupta. You've just answered my question that 1 hour more is okay, because it's otherwise not practical to have the children go to bed on a weekend on the regular daytime. So thank you so much. This is just very applicable for us also, again, as professionals. We are almost towards the end of the round of questions related to the sleep. And I'm sure one of the answers to this question also is going to be sleep. The question is, what steps can I take to build natural immunity in my child? I think this is a question which all of us struggle, being parents of a neurotypical child as well.
The three things which make you immune is again start with sleep, exercise, and food. So these are the three things where we should be working. In sleep, adequate duration is very important that we had discussed. I don't want to discuss. Physical exercise is very, very important. And that is where we are all failing short. एंड इफ यू हैव टू टीच मोस्ट ऑफ द मदर्स से मेरा बच्चा खेलता है नहीं उसको घर में बैठे रहता है मैं बोलता हूँ आप खेलती हो क्या आप एक्सरसाइज करती हो क्या तो चलो लेट्स मॉडल योर सेल्फ आप पहले कुछ करना शुरू करो आप बोलोगे आप हम इस उम्र में क्या करेंगे अरे चल तो सकते हैं वी कैन वॉक वी कैन रनिंग तो छोड़ो हाँ और एक जगह देखा जाता है कि वी वांट आवर चिल्ड्रन टू वर्क ऑन एक्सरसाइज देमसेल्फ डोंट यू थिंक दैट इफ यू जस्ट ट्राई इट आउट आप गार्डन में जाइए अपने बच्चे के साथ खुल के खेलो इवन एट अ लेटर एज एंड यू विल फाइंड दैट द थिंग्स बिकम डिफिकल्ट जहाँ पे थोड़े न्यूरो डाइवर्जेंट किड है उनको प्रॉब्लम्स ऑफ मूवमेंट्स एंड ऑल दैट वहां पे भी मूव द बॉडी दैट्स द थिंग एंड इट विल कीप योर इम्यूनिटी अफ्लोट एक्सरसाइज का दूसरा एक्सरसाइज है अगेन आई एम गोइंग टू बैक टू दैट पॉइंट देयर इज अ बिग मसल इन आवर बॉडी दैट इज कॉल्ड एज डायफ्राम अपना सांस लेने वाला मसल है उसको हम इंपॉर्टेंट करो बिकॉज इफ आई आस्क समबडी which is the first food a child takes, the surprising answer is not breast milk, it is oxygen, air. So work on oxygen, and oxygen is the best immunomodulator, it improves immunity. And now about the diet, there are only 3 words to remember. 3 rhyming words, school में आजकल सिखाए जाते हैं ना, तो 3 rhyming words, fruits, roots and sprouts, that will keep your child healthy. और उसका दूसरा उल्टा है, जो आयुर्वेद सिखाता है कि हम जो खाते हैं वैसे होते हैं. अभी यहाँ पे मैं झगड़ा शुरू कर सकता हूँ आई एम वेरी श्योर अबाउट दैट बट लेट्स टेक एन एग्जांपल चीज एंड पनीर दे आर द प्यूट्रीफाइड प्रोडक्ट्स और वो हम खाने वाले हम भी प्यूट्रीफाई होने वाले एंड व्हेन अगेंस्ट दैट घी इज अ थिंग आप एक टेबल पे रख के देखो टेबल पे घी रखो चीज रखो पनीर रखो 3 दिन के बाद आ जाओ घी विल रिमेन एज इट इज आप बड़े बूढ़ों के लिए नहीं खाना चाहिए घी आई कैन अंडरस्टैंड बट चीज एंड पनीर का जो एक फैड आ चुका है आई एम अवेयर आई मे बी कॉन्फ्लिक्टिंग विद ideas on research but I personally feel that these are the things which are very difficult to digest and they create the problem and in Pune language I say that चितई बंधु मीठा वाले एक बार जी भर के देखो and बंद करो आपकी इम्यूनिटी अपने आप बढ़ जाएगी so
if I might just add to that, this
please
question of how to build the child's immunity, it gets most often asked in the context of recurring respiratory infections, especially in preschoolers and early schoolers. Please remember that this is an age at which they do develop frequent infections. And what my advice is, you build an immune system by getting exposed to those infections. You cannot stay away from those. We are not built with immunity against the influenza virus, against rhinovirus, against all the viruses that cause routine respiratory infections. So every time you get an infection, you get a certain amount of immunity. So they need to be exposed to that. If you keep them cloistered within the house, this typically we faced during the pandemic, the pandemic time when the children were cloistered within the home, they were, sheltered. And then when they suddenly came out in this world, they started getting very frequent respiratory infections. So please remember that every time they get an infection, they are building their immune system. That's natural immunity occurring in the child. And Dr. Nisha, would you like to add something to this? To the
I think
immune building?
most of it has been covered. I think we can move ahead.
Yeah.
I just want to add a
Thank
funny
you so
anecdote
much.
before Riddhi, you go on to the next
Yes.
vaccination related question. But what you're saying, Dr. Sengupta, hits really right at home. So I have a 22-year-old daughter now, but when I was a young mother and she was 2 and going into, preschool, playing with kids and coming home with just viruses all day long. And I was an exhausted mother because she's always sick. So I asked my pediatrician, how can I make sure she doesn't get sick? And he said, very serious, straight face. He said, yeah, you can. There is a thing you can do. And I was like, oh, I have an answer to make sure she never gets sick. He was like, keep her in a bubble. So I got my answer. He was like, you can't. She just is going to fall sick. This is natural and it's okay. It's annoying sometimes when the child is having fever 5 days a week, and she got better and she gets better. So to all the parents, especially young parents who are struggling with, their children falling sick and not being able to sleep enough, just know that there's light at the end of the tunnel. They'll get better. They just have to, like he said, go through it and build their immunity. So thank you for that.
Again, great, value to the discussion. I love the point that Dr. Sunil brought up, that, go back to the nature. The Ayurveda says that whatever you eat is what you become. The ghee is so Indian. Like, I think we just have to go back to our own culture and eat and do what we've been doing. So that's great. Moving on, we have a vaccination related question. How can the overwhelming number of recommended vaccines for children today be explained, especially compared to the fewer vaccines that parents might have received during their own childhood? Again, related to immunity. Me, as a mother of a 3-year-old, I've already been said that it'll help her with the immunity. So I would love to hear the answer for this personally.
Dr. Nisha, why don't you take this?
I think Dr. Sengupta would be the right person, but
Yeah,
I can just
we both are
add and
not picking nowadays.
yeah. Dr.
Why don't you
Sengupta is
initiate
the
the
right
discussion,
person
please?
for vaccination answers.
Why don't you initiate the discussion at least?
Yeah.
I think I will. Madam, okay.
Okay.
Yeah, Dr. Sunil would want to say something?
So, immunity and getting that immunity more and more starts with birth. So, the first vaccine I always say, again, you may think that I'm again going towards the mother nature, is the mother. The breast milk is the first. Everything she has earned in her life, that all vaccines, whatever she has received immunity, she's going to give us like a free, and it is free to the child, and getting the child all that. So please, please, that first vaccine you should not miss. Now, yes, when it comes to this question, I used to answer this question again and again. And I remember, I tell some different story. In 2, 3 decades back, Nirupama Roy, one of the Amitabh Bachchan's mother, she was dying with tuberculosis many times in the Bollywood films. But with BCG, not they don't die of tuberculosis. Now the mothers die of some different thing. So the BCG is one of the success story which is telling us yes, vaccines work. So I believe in that vaccines do work. Yes, how many and how much is another debatable question, but vaccines have got a definite role. Measles. There was a time in our Dr. Sengupta will remember in our BJ Medical or Sassoon days, we used to see measles, bronchopneumonias, and children suffering badly, even some of them dying because of that. But now we don't see too much of now. It is another there's a spike coming up, but yes, measles has gone down a lot, that smallpox and all that, we have forgotten. Now we are not seeing that. So the vaccines do work. But does the vaccine have got a shield of immunity? Big no. Vaccine is not a, glass chamber where you are putting the child. I always give vaccine another upama or example that it's a small sword we teach our child to fight with. I give my own experience of my own child. I gave him a vaccine about chicken pox. And unfortunately, in the school, the child landed up with chickenpox when everything was rampant. I blamed myself. मैंने क्यों अपने बच्चे को prick किया? But one thing happened after 3 to 4 days, he got quickly recovery from that point. And that is one thing vaccine achieves. Vaccine doesn't land up into complications and the serious effects of all this. So that definitely works. Another good example of vaccine which has worked is polio. So there were so many cases in our when we were small at that time, and now how many cases of polio you see? It has worked. So vaccines do work. Okay, that balance is a very different challenge. I think Dr. Abhimanyu can add to that part.
Okay.
Just
Yeah.
just to push a bit, as Dr. Sunil said, that see, no vaccine would claim 100% protection. Doesn't mean if you give a vaccine, you will never get that disease. But mind it, even if you acquire the disease, he gave an example of chickenpox. If there is an epidemic on, if there is a child with chickenpox coming to the class and your kid is vaccinated with the varicella vaccine, there are chances that the child gets chickenpox, but a vaccinated kid will always have a very mild infection and also will not get the complications. The complications of each of these diseases, the vaccine preventable diseases, are really horrible. They have lots of complications on the brain. Since I see neurology, I would always talk about the brain. So a simple chicken pox will give you a dreadful complication from the brain perspective, which will not happen if the kid is vaccinated. He might have one or two rashes here and there, nothing beyond that. And this is true for not only varicella or chickenpox, but most, or I would say all vaccines, that the complications are absolutely not there. But yes, 100% protection, no vaccine will give. If you feel, as sir said, that you are going into a bubble or into a glass chamber and no organism would ever attack you, no, that is a misconception. Now over to Dr. Sengupta.
I think you have pretty much covered whatever the messages that need to go to parents. What I'd like to add is specific to the question that was asked is, see, the vaccination schedule of a country is determined by the disease prevalence in that country. Now, each country has its country-specific vaccination schedule. So this becomes very important, especially in kids of parents who are, emigrating from one country to the other. So when you move to your new country, please be sure to connect with your local pediatrician and get the child's immunization updated for that country, because you need to prevent the bugs which are prevalent in that country. Okay. Having said that, well, the vaccines that are available currently in India brings it on par with all international standards everywhere in the world. Okay, so if you follow the vaccination schedule that most of your pediatricians are recommending, you will, moving from one country to the other will be a very smooth experience. Okay, you probably won't even need to take any additional vaccines. Number three is, yes, you tend to get a little overwhelmed with the number of vaccines that are there in the list when they, when the first time when you go to the pediatrician, they give you a file and with a whole list of vaccines to be covered from from the time of birth till the age of 15, 16, 17 years, till whenever the pediatrician is seeing the child. Well, uh, there are two vaccination schedules which are available in India. One is the national immunization schedule, that which is provided by the government in free of cost in government health centers. Okay, that is that's what the government can afford to provide in the budget that it has. The other is in the private sector, which gives a few more vaccines than what is given in the national immunization schedule. But yes, you have a lot of vaccines. The bulk of the vaccines gets done in the first 1 to 1.5 years of life. After that, the vaccines are much less frequent. Okay, I don't think we probably have time to go through each of the vaccines, but yes, the vaccination schedule is bound to be different from what you had as a child, because science has progressed to that extent. You cannot deny the progress of science. And we have been able to control and contain many diseases that were not thought to be controllable earlier. Okay, I think between Dr. Nisha and Dr. Sunil, they have enumerated all the diseases, the polio, and I probably add hepatitis A to that. Hepatitis, we used to see so much jaundice when I was in my student days, but nowadays we hardly see the hepatitis A occurring because of the wide coverage of vaccination. Right, I think
Thank
that,
you so much.
yeah.
Yes, that's profound. Thank you so much for the information. There is one follow-up question to this in the chat. It says, is it true MR vaccination leads to ADHD?
No.
I think no, that's a simple answer. And there are so many scientific researches which have come up. Even the person who has published in a very renowned paper across the world it has been withdrawn that there is no direct. It is not only ADHD, it is also associated with what autism people used to say. But it is not related to that, and don't get panic about that, because there is a most of the time these diseases start presenting by the time we give MMR in the previous that 15 months. And that is why that coincidental association was found out and said that it is because of that. It is not so. There are many genetic references to these diseases and not related to the vaccination at all. So let's
Great.
clear it. No.
Yes. Thank you so much, Dr. Godbole, for the clarification. I think we are done with our list of questions that we had. And while I'm reading the chats, I can see a lot of positive comments for all of you three doctors. So there are these parents who are saying that absolutely true, Dr. Sengupta. Love the information, superb explanation. So all of us as parents are loving all the discussions that we've had. Moving on to the questions here. I am just going to address few questions which we could not address earlier. So we are going to look at this question which says, my son is 15 years old. In his school, they gave facility for exams as MCQs, multiple choice question, pattern question paper. earlier, but now in class 9 there is no facility like this. And so now he's facing problems in writing and learning, as earlier it was easy for him and now he can't write. Any suggestions that y'all can give in terms of your doctor perspective?
Yeah. There is something which is called as modifications and accommodations, which each child with his own capability we should be given. Then it comes with the disability certificate, knowing the child's learning capabilities, learning difficulties, his background disease. And what is important now is when you are learning in such a way, there is always going to be a tussle because the child may not be able to cope up with the way the school is going through. And unfortunately, the 10th standard, as it comes in most of the schools, especially inclusive schools, if it is for every other child, then it is going to be a tough time for our child to go through it. But you need to talk to the school teachers, the school counselor, and find out what are the modifications, accommodation your child can get based on his degree of disability and the disease the child is going through. So that is a technical answer. Now the practical answer. The practical answer is now we should be finding out is the only academics important for our child. When you are saying at a ninth standard we are having learning issues of that severity, I totally appreciate. We all want our children to have got 10th standard label, then 12th standard label. And one thing is proved that in the life, nothing stays. So we should be starting. I request the mother over here. Okay, talk to the school, get the modification accommodation which are best for your child. Get the counselor in picture. You can talk to the. You can go to the gadget of India where you can find out what the child can really help you or what there are good people to counsel about it. At. But when it comes to the whole holistic approach to the child, I give a formula that don't look at that age. Don't only focus on this academics. You should work along with academics on the personality. I divide that age into three parts. One third for the school, one third for the self-care, and one third for the skills the child should be mastered. And there, the academics is not the only way to work upon. Please add other skill sets to your child. And then you will understand that, okay, now you're looking in a different perspective. Okay.
Yeah,
For
thank you
that
so much,
particular child, we
Doctor.
need to know more about his skills and problems.
Yes, thank you for
If
the
I might,
insight. Yes, yes, Dr.
if I might
Sengupta.
just add to it, this is not as a pediatrician. I'm going to be adding this input as an educator because I have taught 10th grade biology to kids, okay,
Wow.
for several years. Yeah. So this is something which I faced particularly in the just following the pandemic, because in the 2 years of the pandemic, they were used to their online classes. There was very little writing involved. And the moment they came back out of that pandemic and they got back to physical classes, this was a problem in which was there in 60 to 70% of the kids. They just didn't have the speed for writing. Okay. They would tire out with half an hour of writing where they were supposed to write a 3-hour paper. Okay. So for this is of course leaving aside those children who are challenged for some reason or the other. But in other children, it's very, very important that they practice their writing skills. We don't have any shortcut to that. Unfortunately, our examination systems are still geared to writing 3-hour answer papers, question papers. Okay, so you just have to get that in your, you have to work that into your system. Now, this is something I has to give them as an exercise, as to make them write while I taught them. Okay, so this is just an additional input to what you said, Dr. Sunil.
Yeah. And you just confirm that writing, is there a fear factor to that? Or is there a there's a lot of stress which has occurred and that's why the child is the tendency of not to write comes with either the skill set missing or the behavioral part, the emotion part of it. He has some unfortunate experience, frustration or shouting for that. And then now he said that I can't write. And then he goes into that avoidance mode. And if that is the then you will get a good counselor, give him that buckle up his confidence, start asking to write small things. And I always say a very interesting sentence: celebrate the weaknesses. If your child writes 2 sentences, dhol bajao, there is a chance that another 3-4 days the child will start writing 4 sentences. So celebrate the weaknesses. We always celebrate the success. We don't celebrate the weaknesses. So in this child, the answer may be weakness celebrate karna shuru karo.
Thank you, Dr. Godbole. I think this is great. There is one more question related to vaccine. The parent Purva Jain, she's asking, is it good to avoid MMR vaccine? As we listen from various medical associates that it harms child's cognition development. Can you help us clarify this?
I think Dr. Sunil has already answered that. He said that when for the previous question
Okay.
that MMR vaccine related also there were some sort of myths, but that's not true, and vaccine should not be missed. And
Yes.
it does not contribute to either autism or ADHD, or for that matter, none of those vaccines contribute to any of the neurological or the neurodevelopmental illnesses.
Thank you so
Great.
much for re-emphasizing that point.
Yes,
That's a
yes.
widespread myth that in the parent community based on that one study that was done so many years ago. But I think somewhere it emotionally stays as a fact, and it's not a fact. So I do hope parents, you've paid attention to the doctors telling you that that's not a fact, and do not go that route of not taking vaccinations, because we just learned how important vaccinations are. All kinds of vaccines will help prevent the complications in your children. So just, I hope you've heard that very loud and clear from
Yes.
all of them. Vaccinations are important, and they do not have any connection to autism that we know of. So appreciate that point.
Yes. Okay, we are going to address the last question. It says, my daughter constantly suffers from vulvitis, several lifestyle changes later, and it still reoccurs. Any suggestions?
Not a right question for this platform.
Even
Okay.
I don't.
They should meet the pediatrician or the gynec depending on the age, and
Okay.
need to be treated. It is a medical problem, and has to be treated as a medical problem.
Great. Yes, so we are towards the end of the entire panel discussion. I really appreciate the time that you all have given, doctors, to us, each and every feedback that you've given. There were a few questions which were academic related, but we just wanted your insights in that, and we loved each and every suggestions, each and every inputs that you've given. Thank you so much for your time. I would have Dr. Shivani to take over and continue sharing her feedback.
Yeah, so first I want to thank all the parents for being here today and being so engaged in the conversation. I do hope that you've taken notes. In any case, we will be sharing some summary of the discussion on our social media channels later on. We'll try to see if we can highlight some of the discussions and insights that we all have learned from. So do follow us on our social media pages, and do join us on our WhatsApp community of parents so you can learn more. And to Harshali, thank you for being here, and SNIC Rehab Foundation for always being our parent ally. So we appreciate you. And to Dr. Sunil Godbole, Dr. Nisha Deshpande, and Dr. Abhimanyu Sengupta, thank you so, so, so much for this incredible, not only sharing your time and wisdom on a Sunday morning, which is supposed to be your day off. You have taken the time to teach us all. So I do appreciate that a lot. And on top of it, for this session to be so incredibly insightful, every single question that the parents had for you, I think you've given them above and beyond, information. That was just one question we presented, but you have given us a depth of knowledge and information on all the three topics that we learned today on sleep, diet, and vaccination, and more. So genuinely appreciate each one of you. Thank you so much for being here today. Harshali, would you like to say something before we wrap up?
Yes, it was amazing and wonderful session. I would request all the parents to go over all the answers again and again to understand the depth of each sentences. Because if you apply these, all of this in your practical life, that the life would be very much easier. Because I could relate to various answers that all the doctors have suggested. So thank you so much. And I'm very grateful to Saamarthya team as well. Thank you so much, parents. Thank you so
Thank
much.
you.
I do hope that we will have you all back some another day. We'll work on it.
Sure.
You're doing such a good
Thank
job.
you.
Yes.
Have a wonderful
Thank you
day.
very much. It's been a pleasure interacting with all of you. Thank you very much.
Thank you.
Thank you. Thanks for having us, and it was a pleasure. Thank you.
Thank you.
Thank you so much. Have a wonderful
Thank
day.
you so much, doctors. Have a great day. And we are going to share all our responses and the feedbacks that we get on our WhatsApp groups. I'm sure the parents are going to share more about your help that you all have helped us with today.
And
Thank
we'll
you so
also
much.
share our link of this recording with each one of you so you can have it.
Please.
Yes.
Thank you so
Sure.
much. Thank you.
Okay.
Thank you.
Bye-bye.
Yes. Bye-bye,
Bye.
everyone. Have a very
Bye.
good day today.